going on. But it's a lot of stuff, and we're going to keep it on schedule. I'm Alex Fair, as I know most of you, and one of the best things about my job is I get to meet so many of you as you're going up and down the startup ladder and trying to find great companies to work with and looking for companies to invest in. And you guys actually are the most amazing thing that happens here at our events, Health 2.0 and on the MedStarter website, which grew out of Health 2.0. Is Dan Kogan in the room yet? Oh, okay. The founder of Health 2.0 New York City is actually coming today, so when he comes, I'll point him out. So this is the rise of the healthy machines, and it's all about machines that make us healthier, machines that remind us to take our medicine, machines that tell me I didn't walk enough, machines that tell me to check my blood glucose level, machines that make me healthy, and they're getting smarter and smarter, more cognitive, and it's not just marketing anymore. It's real things. You'll see a bunch of companies today that are really just changing everything with AI, with personal coaching that actually works for people, with ambulances that are just smarter. And it has great potential for reducing costs and for improving care, and that's what we're all here for, right? So I'm not gonna stand in the way very much, because our speakers are much more interesting than I am. So our very first speaker today, Wi-Fi password if anybody needs it. There it is. That's not a speaker. Oh, speaking of which, the hashtag for today is Rise 2017. Now, I know you guys think you're just in a room here, right, with 176 people RSVP'd, 50 of them yesterday, thank you. You guys might want to do that earlier. And if we run out of food later, it's because I didn't. Let's not go there. Anyway, so this isn't just happening here at MedStarter Momentum. Anybody was at MedStarter Momentum this year? Okay, 23 million impressions on Twitter, and we trended. Look at that. We're healthcare tech. We're trendy. I never really thought that would ever happen, right? So just show of hands. How many people finished high school? Everybody? Come on, don't be shy. How many people finished college? How many people finished a master's? Keep your hands up. Okay, how many people have PhDs, JDs, MDs, or anything that was a lot of pain? Okay, that's amazing, right? Because we're the ones who are actually doing this stuff. That counts if you've had to figure out how to code in like COBOL or something too, I think. Yeah, chemical warfare counts. You know, thank you, Dan Pierce. So I also want to thank our sponsors. So let's just do a big round of applause before we even get started for having this beautiful room. Walter Olshansky from PwC and the rest of the PwC team are here. Just a big round of applause just for PwC. Because without them, none of this other stuff would be possible. Another really big sponsor for us in the last year or so has been DataArt. DataArt creates amazing stuff, and Dan will tell you a little bit about more of that later. And of course, our oldest sponsor, not to say they are the oldest, but McCarter and English now has Joe Daniels on the team, who has been sponsoring us, believe it or not, since 2010. So he's been in our corner, and now as we go into MedStarter Ventures, he's working with us on a lot of other stuff. So you guys are all fantastic. So I'm not going to run through the schedule now, but you guys have it all. All the same data up here is also in your laps in those programs. And without any further ado, because I'm taking time away from Jeff. Let me introduce Jeff Nadler. Teladoc, everybody knows what Teladoc is? Everybody? How many people have used it? That's good, that's good. It's changed a lot. I remember when they were a tiny little nothing company, and now they're huge, doing great. So he's in charge of all that tech, and it's a tech company. So I'm gonna hand over everything to him and let him start talking while we queue up his presentation.
Sounds good. Thank you, Alex. Hello, it's great to be here. Alex has done it again, assembled an amazing panel of speakers and panels. I'm really happy to be here. I'm also honored to have a chance to kick this off today. I'm Jeff Nadler. I'm the CTO of Teladoc. I've been a CTO for about, since 2004. About half that time with Teladoc. I joined Teladoc in 2010. And before that, I was the CTO at Active Health Management, another New York-based company. Before that, I was active in financial services IT. I've been a consultant, and I have an electrical engineering degree from my alma mater, Union College. Okay, so our mission at Teladoc is to provide convenient access, easy access to affordable, high-quality care. And I'm going to talk today about how we do that. Like any good engineer, I think I hit the wrong button. Like any good engineer, I'm practical, and I like to simplify things, hence a very simple agenda. I'm going to talk about who Teladoc is, what we do, how we do it, how do we make it easy, and how do we use machines. Also, hopefully there'll be some time to talk about where we're going. I don't think we'll have time for Q&A. Can everybody hear me in the back? Okay. So who are we? We're the first and largest telemedicine, telehealth company in the United States. We were founded in 2002. In 2016, we performed over 950,000 telehealth visits. Let me repeat that, 950,000 telehealth visits. When I joined, we were doing about 50 a day. Simple math gets that number to about 20,000 a year. So roughly 45x from when I joined. And the funny thing is that we were having performance problems when I joined. We went public July 1st, 2015, an absolutely exhilarating moment in my career. Coincidentally, today is our earnings day. So at 5 o'clock today, for anyone who's interested, can read about our fourth quarter and the year 2016. We're headquartered here in New York, in Westchester and Purchase, New York. That's where I'm based. We have offices in Manhattan, the Dallas, Texas area. We have offices in Phoenix, Scottsdale, and Mountain View, and we have about 700 employees total. Ooh, skipped ahead. Might need some technical support here. Sorry. Okay. It's not coming out there, but it's here. Function F7. That's good. Little technical difficulties. There we go. Okay, so the American Telemedicine Association estimated that there are 1.25 million telehealth consults or visits in 2016. We performed, as I said, over 950,000. It's about 75% of the total market share. Very proud of that. Some key metrics at a glance. Compound annual growth rate of total revenue is 80% in the 2013 to basically the past 3 years. Total membership, CAGR, about 40%, and total visits about 95%. What's interesting here is that our visit growth has consistently outperformed our membership growth. What that means is that more people are using the service more. More people using the service more translates, this is a good thing, it translates into more savings for our clients. So what do we do? 24/7, 365 access to US-based, all board certified, licensed in the state that they practice, access to physicians via phone, web, mobile app, or video with a median response time of less than 10 minutes. We diagnose and treat and prescribe medication if appropriate, routine, episodic conditions such as headache, cold, fever, flu, bronchitis, sinusitis, all kinds of routine, simple stuff that people go to see doctors in person every day, all day. We have a proven ROI based on independent third-party research, which is basically the idea is if you do a telehealth or telemedicine visit with a Teladoc, and we keep you out of a higher cost option, like an urgent care facility or an ER, we're saving the payer or the risk bearer money. And I think everybody in the room probably knows it doesn't take more than a handful of ER avoidances to save a lot of money. Where do we do it? So we're basically in 49 of 50 states. Arkansas, big shout out to Arkansas. They're the outlier. We do not do telehealth visits in the state of Arkansas because of regulatory reasons in that state. However, we believe we will be turning on Arkansas in 2017. I'll get to Texas. Idaho. Idaho, we're video only, not a problem. And Texas, we're phone and images only. Teladoc is a B2B2C company. We sell to large employers and to health plans who then make the service available to their membership. It's convenient. People love it when they use it. Our member satisfaction is off the charts. But at the end of the day, we save our customer, the employer or the health plan, we save them money. And that's why they buy it. We have another sort of market segment that we go after, the hospital system and hospital and health system, where we license our technology to enable them, using their providers, to perform telemedicine visits. And then a very interesting aspect of that model is that the Teladoc physician network becomes a wraparound. So when the health systems providers are not available to take the call from the members who participate or belong to that hospital system, the request would automatically roll over to the Teladoc physician network. It's a nice backup, and this is a rapidly growing business model for us. So what exactly we do? I mentioned, the sort of the routine kinds of issues that we treat all day long, and we prescribe. So if medically appropriate, we prescribe through the SureScripts electronic prescribing network, which lets members then pick up their prescriptions automatically in their local pharmacy. We do not prescribe any controlled substances and no lifestyle medications for obvious reasons. We have a very high resolution rate. What does that mean? That means in over 90% of our visits, there's no further medical care needed. Okay, back to the ROI question. There are some naysayers out there who think that telemedicine drives up utilization. Our results, which I'll actually get to, independent research confirmed our results on the next page. But some of the things that happen that we cannot, in that remaining 9%, there are drug seekers who call us looking for Vicodin. We turn them away. There are actual cases that are inappropriate to treat remotely or virtually. We turn those away and refer them to specialists or primary care physicians. And we actually save lives too. So in 1% of our visits, we are referring the individual into an ER. So in 2016, a 38-year-old truck driver, healthy, was having chest pains. He remembered recently getting the Teladoc health benefit card and thought, let me give this a try. Called the Teladoc physician. Physician diagnosed that he was having a heart attack, sent him to the nearest emergency room where that diagnosis was confirmed. So RAND published a study in Health Affairs after analyzing about 300,000 Teladoc cases and then looking at claims data, both after the Teladoc visit. And the big reveal here is that in 94% of the visits, there was no further medical attention needed, as compared to 13% from an office visit and 20% from an emergency room. Now, why is that? There's two reasons. The things we treat are on the simple end of the spectrum, often not requiring any kind of follow-up. And how many times have you been to an urgent care or an ER where they don't tell you to follow up with your physician on the way out the door? Clinical quality is extremely important to us. We do chart reviews for all new physicians. For the first 3 months they're a Teladoc physician, we review 100% of their charts. Afterwards, we do about 10% of all visits. Excuse me a second. I'll talk a little bit about more in a minute. We also do a lot more than just the sort of routine episodic things that I mentioned that we consider to be general medical. We do pediatrics, we do dermatology, we do behavioral health. We have a sexual health program, we have a tobacco cessation program, and we do specialist referrals. How do we do it? So our physicians, we have a network of over 3,000, as I mentioned, all US-based, all board certified and licensed in the states that they practice. Some of them practice full-time for Teladoc. Many of them have bricks and mortar practices. Some of them are ER physicians that have a lot of downtime. Some are semi-retired. Some are mom docs that have little children at home and squeeze in extra time for Teladoc visits. Just coming back to quality for a second, at our board of directors level, we have a clinical quality committee led by surgeon, doctor, and former Senator Bill Frist to oversee all of our clinical protocols, all of our quality initiatives, and make sure that we're delivering the highest quality care that we can. Interesting statistic here on my right side, yes, is that females use the service more than males. We suspect this is mostly for covering for pediatric cases where the mom is typically the doctor of the household. We're, as I mentioned, 24/7. I think the interesting chart is here, which is we're doing consults pretty evenly spread out over the course of the week. It's not just nights and weekends when your primary care physician's not available. If you look, Monday typically is our busiest day, and that's a little bit of a hangover from the weekends, and people aren't feeling well. And rather than go to work Monday morning, let me call the doc. Very interesting statistic here. Yawning, come on. So our service is available. We've always been a consumer choice in terms of accessing and interacting with Teladoc. And what that means is that we let members choose how they want to interact with Teladoc. So the main modalities are, we have a web portal, we have mobile apps, and we also have good old-fashioned 1-800-TELADOC, where members can register for the service, complete their medical history, and request a visit just by speaking to one of our customer service representatives. 50% of Teladoc visits are completely 100% phone calls into our call center. Now, hopefully that comes as a surprise, at least to this audience, and we are seeing significant trends up in mobile app usage, and we are seeing trends down in our call center. Hopefully that will continue. How we make it easy. So I mentioned our mobile app for the members. Everyone that comes to Teladoc or presents at Teladoc is someone that we already know. Because we sell the service to the employers and the health plans, we're getting eligibility. So when you knock on Teladoc's door, we match you up based on normal demographic data because we already know who you are. So the first step in the process is to register, and that's the process of matching against your eligibility and completing your medical history. We will not treat anybody without completing a medical history first. Same thing as the clipboard at your primary care physician's office. And then you simply request the consult. And the visit can be conducted via phone or video through the mobile app directly. And the last step is simply if a medication was prescribed, you get confirmation that it was sent to your local, local pharmacy of choice. Very simple. Very proud of our award-winning mobile app in 2016. We won the Golden Pencil Award from One Show and the Online Marketing Media and Advertising Award. So in 2016, we did about over 280,000 downloads of our mobile app, which represented over 450% growth from 2015. Ta-da! No, I'm not over. I'm not done. What happened? Is it back? It's back. Okay, sorry about that. I mentioned 95% member satisfaction. People love it. They absolutely love it. They use it once, they're sold. I talked about our resolution rate and would people use it again over 90%. Listen, in healthcare, anything with a member sat score over 12 is off the charts. Okay, so how do we use machines? I mentioned in 2016 we did over 950,000 visits. So that translates to, and by the way, our visits are seasonal. So we do more visits. We follow flu season, right? So flu season is typically December, January, February, a little bit into March, and varies by region. But our busiest time of the year is basically December to right about now. So our busiest day, most recently, over 5,000 consults a day. Our busiest hour was January 2nd. We did 503 consults. That's about 1 every 7 seconds. And let me take a step back and talk about the different ways that we deliver consults. We basically have 2 modalities. Members can request what we call a scheduled consult. So I want a consult tomorrow at 3 o'clock. Or they can just say, I want one as soon as possible, and we call that a jump ball. So we have a routing engine that takes all the requests, and every second there's new requests coming in, there's new doctors clocking in, there's doctors clocking out, there's doctors grabbing consults, there's doctors completing consults, and there's routing rules. So if, depending on the state that you are physically located in, you have to be treated by a physician with who's licensed in the state that you're physically located in. So we have all these routing rules that are constantly changing and delivering consult requests to the physicians that are there to deliver them. So this is a pretty, this is probably the crown jewel aspect of the platform. Machine learning is something that we're transitioning to. Some of the tools that we use, scikit-learn, Python, R. And let me talk just a little bit about a couple of things that we're working on that are in our sort of R&D stages. So research says, and I love the analogy to when you go into the subway and you see it has how many minutes till the next train comes, and you're psyched because you know how long the wait's going to be. Research shows that the perceived wait time is significantly lower when you're informed how long the wait is going to be. So we have developed a sort of traditional rolling average wait time calculator. Basically looks at the last 3 hours, throws out the outliers, averages them, and then we use that to predict how long the member's wait time is going to be. And we've started to experiment with some of the machine learning tools. So the inputs are the state you're in, the product that you're interested in. So, you know, dermatology would be different than behavioral health, which would be different than general medical. The day of the week, the wait times over the past 3 hours, the count of the visits in the queue, how many other people are waiting, and how many doctors are actually online eligible to take your consult. And the output is the estimated wait time. Our second sort of application of machine learning is doctor recommendations. We want our members to be, you know, even more than 95% satisfied. So we're experimenting with using machine learning to match the best doctor to the individual. So the inputs are the age of the member, the gender, language, state, bunch of other things, and the machine learning algorithms come up with 3 recommendations that we'll then present to the member. And the third sort of flu trend that we're experimenting, the third machine learning that we're experimenting using machine learning is a flu trend. It's very important to us. As I said, our seasonality, our visit volume trends or correlates to flu trends. So we have an opportunity based on all the data that we have to create predictive trends for where the flu is going to be. The inputs are this stuff is kind of obvious, but count of flu cases by state, by day, the day of the year. I mentioned it's very seasonal, and last year's trend. And the output for us would be a flu trend. A couple quick things about where we're going, and I think we're sort of running out of time. So I talked about mobile, I talked about web. We're building access via the Amazon Alexa, no big surprise. We're looking at something in a mobile, sort of like an OnStar way to access Teladoc for the future, and also smart TVs at home. We just announced a partnership with Kinza, which is an electronic or digital thermometer that we now have integrated into the Teladoc app. So if you're a user of the Kinza app, the thermometer data is now automatically brought into the medical record that we keep for you at Teladoc. Geofencing. Our first application of this is we see that you're in an urgent care, and if you're eligible for Teladoc, we want to remind you, hey, wait a second, did you know you could just access Teladoc? Analyte Health was a partnership we announced recently, a laboratory vendor, so that we can expand the scope of conditions that we treat by doing laboratory testing. And Analyte Health is also our partner for the sexual health program. We also recently announced a partnership with AARP, where it's called a sort of caregiver model for those of us with maybe elderly parents. We can establish a 3-way interaction with a physician so that the caregiver is on the phone, the patient is on the phone, and the physician's on the phone. I think that's it. So I don't think we have time for questions. I'll hand the mic back to Alex. I'm around all day if anybody has any questions and would like to talk further. Thank you very much.